हा,
BP check केलाय.
काय काय त्रास आहे ना?
त्यांचे पाय जास्त दुखायला लागले.
बर, अजून?
आणि कधी तर असं चक्कर आल्यासारखं होतंय.
बर, धाप?
घाम जास्त यायला लागलाय.
बर,
जास्त चालायला गेलं की जरा धाप लागायला.
ठीक आहे. ह्याच्या अगोदर बीपी आहे कधीपासून माहिती आहे?
नाही काहीच त्यांना.
बर, औषधं नाही आहेत ना चालू?
हा, नाही येत काहीच.
ECG मशीन आहे का सोबत?
नाही.
ठीक आहे, मागवून घ्या आणि ECG करून घ्या.
मला नाही भेटली.
ठीक आहे, दे त्यांना पेशंटकडे. मावशी, काय काय त्रास होत आहे?
लई त्रास व्हायला बाबा, पायच गेली व्हायला. छातीचं दुखतंय, डोकं दुखतंय. जास्त घाम येते चालायला गेल्यावर.
कधीपासून व्हायला हे सगळं? कधीपासून व्हायला हे सगळं?
दोन तीन महिने झाले.
हाय, जरा बीपी जरा जास्त आहे. औषधं देतो मी, औषधं चालू करा आजपासूनच. आमच्या ताई देऊन टाकतात तुम्हाला औषधं. काही तपासण्या पण कराव्या लागतात, करून टाकू ते घरीच. होतंय कमी? पायावर सूज आहे का?
आहे सर.
बर, दाखव बघ जरा पायावरची सूज दाखव. बर, त्याच्यावरती थोडासा हे बोटान दाबल्यासारखं कर. नडगीवर खाली, अजून खाली 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 ग, गुडगा नाही, खाली. तो गुडगा आहे, खाली. अजून? हा, दाब बोटाने तिथं आणि दाखव मला व्यवस्थित. तिथं खड्डा राहते का?
खड्डा पडल्यासारखं व्हायलंय सर.
बर बर बर, त्या आजींना व्यवस्थित दे, वरती घे. आजींसमोर. आजी, पाय कधीपासून सुजायलेत?
लई दुखत बाबा पाय तर. सकाळ सकाळ चला म्हणायचे, सूज चालायला गेल्यावर बसूच वाटते, चलूच वाटना.
बर, सूज किती दिवसापासून आहे?
करायला नाही. आज तर जास्त झाले पाय.
सूज कधीपासून आहे?
पाय कधीपासून सुजले तुमचे? सुजलं ना आता हे कालपासून कालपासून जास्त होणार, त्यांना ऐकायला थोडं कमी आहे.
ठीक आहे शुभांगी, मी औषध स्टार्ट करतो. त्यांचं KFT, किडनी फंक्शन टेस्ट करायचं. शुगर किती केली आता? शुगर किती आली आहे? 182 आली आहे. बर, काय जेवण कधी केलेलं आहे?
जेवण किती वेळ झाले?
बर, मग त्यांची शुगर जास्त आहे. HbA1c, ECG, त्यांचं KFT, किडनी फंक्शन म्हणजे क्रिएटिनिन, हे सगळं करून घेऊ. शरदला सांगून दे आणि ह्या सगळ्या तपासण्या जागेवरच करून घे. ओके, मी आता औषध प्रिस्क्रिप्शन टाकतो, त्या पद्धतीने प्रिस्क्रिप्शन करून घे. Now if we look at this case, this is really a very interesting case actually, and let me tell you about how this case should be managed through telemedicine. If we see her blood pressure, the first BP is 180/107. This is her first first consultation with the doctor. If we see her sugar is 182 fasting, her blood pressure 182/107, and this is her first diagnosis of hypertension. Before this, she has never been diagnosed with hypertension. She has anginal pain. She gets sweating when she is walking around, and she is having dyspnea. She is having palpitation and headache as well, which all can be related with the blood pressure readings. Now another thing of concern is when during consultation we saw her pedal edema. The pedal edema is quite, I mean, pitting edema, and her symptoms are correlated with probably an ischemic heart disease, and probably there may be some LV dysfunction as well. Now there are all risk factors. WHO ISS risk score is 40%, and if we see her blood pressure and sugar readings, she is absolutely at risk of developing all other things. Now what to be done? As you have seen in this video, there first there was the SHL, the social hypertension leader, who was coordinating the patient. Then we had a talk with the patient actually, and inquired about her symptoms personally. Then we as a doctor actually made an impression that what she might be having, and now we are advising her investigation. Now the MH clinic has its point of care devices, a point of care system, where the ECG machine, the HbA1c machine, urine microalbumin machine, the creatinine, all these things, all the investigations are to be done at the point of the particular patient. As we saw, this patient is from a very peripheral village, actually a rural village. We will be reaching to her probably by today evening or tomorrow and doing all the investigations, and again we'll be starting her on the proper medications after completely risk stratifying and evaluating her. And meanwhile, when we are seeing the baseline blood pressure is quite very high, symptoms are absolutely correlated with the findings, I'll be making her diagnosis as hypertension. Probably I'll just wait for HbA1c to make a diagnosis of diabetes or ischemic heart disease or coronary artery disease. I'll just wait for that. For as far as the pitting edema is concerned, there is possibility she may have some kidney disease as well, but we are not going to make any hurry to make a diagnosis of that as well. So I'm just adding up with this, as we have seen there are not much reports over here, and then I'll be going for the prescription. I'll be prescribing her to start with the amlodipine. I'll be prescribing amlodipine plus hydrochlorothiazide. That would be my first choice as of now, and after investigation, if I would like to switch to, if I say that we are okay to switch towards the AC inhibitors, ARBs, then I think we can switch over. As we have found that her WHO ISS risk score is quite high, she needs to be started on atorvastatin and aspirin both. So as far as her cardiovascular risk is concerned, she needs to started with this, and I'll be starting her on aspirin and atorvastatin both. So statin and antiplatelet is added as far as risk stratification is concerned. And now for her dyspnea, for her other symptoms, I think I should be waiting for a day or two to get her completely diagnosed, and then go ahead to start with any other diuretics or anything else. This patient also needs an echo evaluation, for which we have tied up with a nearby local hospitals where the echocardiography facilities are available, and these patients get echocardiography in a very economical manner as well. So now this way, though the patient is in periphery, in village, we are managing the patient with absolutely the Global Hearts Initiatives guidelines, protocols, and the Lancet Chemistry on Hypertension's guidelines and protocols, and we are not missing out the patients in clinical or pathological views. So I'll just add this into the prescription, and the patient have been educated about her lifestyle and salt reduction, these things. So I'll just add up this and I'll advise her investigations. I'll advise her diabetes package, so that includes HbA1c, creatinine, total cholesterol, and urine microalbumin. I would also want her thyroid to be done, and then I would like her to have the echocardiography done. So that is the advice for her as of now, and then accordingly we can manage the patient. So this is what from Mobile Hypertension Clinic and Rural Health Progress Trust we are doing at Usmanabad and Latur districts. and this project is mandate project management of diabetes and hypertension in Indian rural villages, supported by World Diabetes Foundation Denmark, and CDC US, and the Lancet Commission on Hypertension. Many patients in villages, peripheral villages, age old patients are getting benefited through our very economical standard protocol based model, where the patient is being treated at par the international clinical guidelines, and many patients are getting good results to have their risk reduced or morbidity and mortality modified. Thank you. This is Dr. Arun More, founder and a clinical cardiologist of Rural Health Progress Trust and founder of Mobile Hypertension Clinics India. Thank you.